Awesome. Thank you so much. Hello, everyone. Thank you all so much for joining us today for our Breakthrough Series Collaborative Information Session. My name is Sujina Perajuli. I am the lead program specialist for our Integrated Healthcare Initiative program here at Mental Health America at Greater Houston. So at Mental Health America, our mission is to drive community solutions to promote mental health for all. We do this by utilizing education, advocacy, and collaboration to help support system change through a collective impact. And our purpose at Integrated Healthcare Initiative is to create partnership, provide leadership and vision, advocate and educate, and provide technical assistance to help implement and sustain integrated care. And our vision is that integrated care that is accessible, it's cost effective, and it is the standard delivery of care for all. So with that, let's get started with our info session. So Breakthrough Series Collaborative, it's a model that was created by the Institute for Healthcare Improvements. And in order for us to lead this program, my director, Kara Hill, and we had to be trained by the Institute of Healthcare Improvement. We also have to put together a collaborative team and faculty members who are going to be the experts in the field. So this is our collaborative team members for the program. We have, first off, Monica Harrison. She is a licensed social worker and has extensive experience working as a clinical leader, working on teams in inpatient and outpatient behavioral health, specialty medical setting, and federally qualified health centers. She worked for a large hospital system with outpatient primary care clinics in Connecticut, providing program building and leadership similar to her time at the FQHC, starting their own collaborative care service delivery. And currently, Monica, she is a practice coach and clinical trainer at the University of Washington Ames Center. So she's going to be our lead faculty for this collaborative. Then we have Kara Hill. She's our director for the Integrated Healthcare Initiative program and also will perform as the director for this program. I will be the improvement advisor, and we have Victoria Salgado, who will be the program coordinator. And these are our faculty members for the program. They are all nationally and internationally known for their work in the collaborative care model. I'm going to give you a quick introductions for each one of them. So I just mentioned Monica Harrison. Then we have Dr. Verna Little. She is an internationally recognized executive advisor for her work integrating primary care and behavioral health, developing sustainable integrated delivery system and suicide prevention. So Dr. Little, she's also the chief clinical officer and the co-founder of Concert Health. It's a national organization that provides behavioral health services to the primary care providers. Her extensive clinical experience and leadership roles have distinguished Concert Health as a leading medical group. And prior to founding Concert Health, Dr. Little worked for New York City, leading the Center for Innovation in Mental Health, and has also served as a senior vice president for a large FQHC network in New York. And there she was overseeing 300 behavioral health and community staff. And then we have Dr. Patty Gibson. She is a board certified psychiatrist and a co-founder and chief medical officer for Arkansas Behavioral Health Integration, which is a nonprofit organization. And its mission is to meet the challenges of integrating healthcare by building relationships, sharing resources, providing educations and training, and advocacy for all. She has been actively involved in integrated behavioral health and value-based population health for over 12 years, including working with blended integrated health teams in Arkansas Baptist Health System and in primary care mental health integration programs at Veterans Healthcare System in Little Rock, Arkansas. Then finally, we have Dr. Daniel Crow. He is a physician executive, diabetologist, and an internal medicine physician with over 30 years of clinical practice. Dr. Crow was a senior medical director and with Superior Health Plan, where he led efforts to integrate physical health and mental health and to address the complex need of those with multiple chronic diseases and substance use disorder. So he was also a chief medical officer of community care in Austin, Texas. It's a federally qualified center, health center. It provides care for the underserved in Central Texas at 22 sites all throughout the greater Austin area. Currently, Dr. Crow, he's a senior consultant with Wild Blue Horizons Health Solutions. And then, so let's talk about Breakthrough Series Collaborative and what it really is. So as I mentioned earlier, this collaborative model, it was created by the Institute for Healthcare Improvements, also known as IHI. So this collaborative, it is a focused 6 to 18 months long improvement project that brings together teams from different sectors who are seeking improvement in a targeted area, and that they're all working towards a common aim. So this is their model of improvement, which has been used in healthcare and other areas like access, chronic illness, organ donations, social services, and even in education. So it's a really systematic approach to healthcare quality in which the organization's team, they can test and measure changes and make sure that those changes are actual improvements and improvements that they want to implement at their organization. So ultimately, it's an improvement method that relies on spread and adaptation of the existing knowledge. And the driving vision of this collaborative is that there's a gap between what the science tells us and what we know we should do, and then what we actually do. So this is designed to help organizations close that gap in our system that may not be set up for integrated behavioral health. It creates a structure in which participants, they can easily learn from one another and make improvements that align with the overall goal for their clinic. So through this program, the participating clinics, they will learn about the model of improvement and how it can help you adapt methods to spread outstanding improvements all across your organization. And these are our goal for the collaborative. Our goal is to help participating clinics further improve their integrated behavioral health in primary care through integration tools, training, resources, and a learning community. And our outcome goal for this collaborative is that the participating practices will enroll 25 patients that screen positive for targeted behavioral health diagnosis and are eligible for the collaborative care model, and 50 of those codes are reimbursed billed by the end of the first 12 months. So what are we doing with this? So our collaborative program, it's going to be a 12-month long program, and our primary focus in this program is to demonstrate improvement in these 3 areas. First is the executive practice leadership. You know how important it is to have leadership endorsement when you're trying to implement and sustain changes in your practice. So we're going to target this area and provide information that will allow your executives to endorse and show that integrated behavioral health is an important part of that transition. We're also going to have goals around the practice changes, financing, and payments as well. And then this next slide, I'm going to pass it over to my director to talk a little bit about the timeline. Kara?
So we want to do this now. Why now, right? Like, why are we doing this right now? And so you may not be in, I apologize, I just dropped my glasses. You may not be in the state of Texas, and that's fine. And we would welcome you, if you are in a clinic in another state, to still participate in this collaborative. But we're focusing on CoCM right now because there have been some new changes in Texas. So we saw the Texas Senate in 2021 pass bills that would support the expansion and utilization of the collaborative care management codes in the state of Texas to be reimbursed by Medicaid. So those were turned on in June 1st, 2022. And therefore, over the last year, we have really been working with national experts on collaborative care to build this entire package. so that we can launch our first Breakthrough Series Collaborative on the collaborative care model in September. Go to the next slide.
Thanks, Kara. Okay, this is me. So here we are with the timeline for the program. Currently, we're at the recruiting and enrolling practice phase, which is right around here. So right after this meeting, you will get an email with our collaborative charter, which will help you to understand what you're getting into, but in much more detail, and will also provide you with the links to the application to participate in this collaborative. Once you've completed the application, you will also receive some toolkits and some pre-work information. We highly recommend that you pick one unit that you'll receive. Sorry, I lost my chain of thought here. So after you receive those details and you complete the application, you'll receive some toolkits and some pre-work information. We recommend that you pick one unit or one clinic within your system to participate in this breakthrough series. And then from that one unit, we'll then give you the tools and resources that will help you to spread the knowledge and the changes that you've made in that one clinic to the rest of your other units. The team members from that unit, they will also need to attend the learning sessions, which are going to be 2 half days. At the first learning session right here, they will learn about the model of improvement itself, our change package and measurement strategies. They'll establish a goal for your team and create an implementation plan. They'll also receive toolkits to track and document changes, successes, and challenges. We will then have monthly coaching calls and reports between after the learning sessions, in between all of these learning sessions. And these monthly coaching calls will be led by our expert faculty members. It'll also include presentations from the teams on their progresses and their challenges, have discussions and provide solutions to those challenging situations, provide monthly reports to show implemented changes and their successes. The practices, they'll also take the changes that they learn in learning session 1, and then they begin to implement those changes through the series of PDSAs. So that is what the first action period coaching call is all about. Action period is all about, which is right after the first learning session. It's for them to basically conduct a series of PDSAs to test the changes that they want to implement and provide monthly reports about your progress, and also come to those monthly coaching calls and connect with our experts to, this is where you would also bring in your challenges that you're facing and get some resolutions and really have an open discussion with our faculty team. And the second learning session, we will discuss about how do they accomplish the next level of changes within that change package. And then again, we'll have monthly coaching calls and reports between learning session 2, and then go through additional series of PDSA. And then finally, we'll have learning session 3, where we will talk about holding the gains and how do you hold on to the changes that you've made, and how do you create opportunities to spread from that one unit to the other units within your system. So overall, our collaborative is it's focused on the collaborative care model. It'll be a 12-month long program, which includes 3 learning sessions, which is more of a learning community where teams from organizations, they come together and learn from one another and receive guidance and support from our expert faculty members. There are 2 action periods in between those 2 sessions, between these 3 learning sessions, and we conduct monthly coaching calls. And this is where the clinics, they will test and measure the changes that they want to implement, and they come into these monthly calls to discuss their challenges and successes and receive the ongoing support from our faculty members. Any questions so far?
I do have a question. Hi, Jen Street. So is this for clinics that already have the CoCM model implemented in it?
I mean, yes, if you need support, to make improvements after implementing the model, then yes, definitely.
Okay. And then otherwise, if there isn't a clinic that we're working with already, then is there clinics that you guys would be like, like, I guess, partnering us up with so that we could work with the clinic to do this project?
Go ahead, Kara.
So what would you see as your role? Do you run a clinic? Do you provide services to help others implement CoCM? What is it that you do?
So I work for a psychiatry clinic, but we are currently trying to roll out the CoCM model in PCP clinics, and we don't have a partnership with any yet. We're just marketing right now, so that's why I just wonder, would we need a clinic that we're already implemented in already, or is there other clinics that you guys have that maybe I would work with?
Good question. So what we would say is that if you have a relationship with a clinic that would want to implement this or want to improve this model, that you could participate with them. So this is focused towards primary care clinics or specialty care clinics that would want to implement the CoCM model. I will say, however, there could be clinics within the collaborative that don't have access to psychiatry or a psychiatric consultant that throughout the process, we could partner them with your entity to see if that was a potential opportunity.
Okay, sounds good. Well, I will continue to listen, and if we get partners, then that would work as well. Thank you.
Yeah.
So here's the schedule for our collaborative program and the dates of when each of the learning sessions and the coaching calls and the one-to-one with our faculties are scheduled. As you can see, the learning session 1, that'll be the launch date, and it's going to be on September 6th. It's going to be 2 half-days long, so 12 to 4 p.m. Central Time. And right after that, we're going to start our action period, which will be from September all the way through January 2024. Then the learning session 2 will be conducted in January of 2024. Again, 2 half-days, 12 to 4 p.m. Central Time. And then right after that, we'll start our second action period, which will start from February all the way to May. And then we have our third learning session, which is going to be 1 half-day. And then we also are going to have action period coaching calls, which is going to be on a monthly basis. And we've also put together one-to-one meetings with our faculty members. And this is where their teams, they're going to be assigned to our faculty members. And this is where they can connect with them on a one-to-one basis. So this is how the schedule looks like. So let's talk about the expectations. So if you want to be involved in this program, here are some expectations upfront. So the expectation is that you or the organization designate a senior leader to serve as a sponsor to do this work. The senior leader will be responsible for attending those learning sessions that I just showed you, providing resources to support the pilot unit or the team. Then you will also need to select one unit or one clinic from your system to participate in this collaborative. And from that one unit, we will also ask you to create an improvement or implementation team, including that executive sponsor or the executive leader. You will need to put together a home team, which includes everyone that will experience the change as a result of the improvements that you're going to make. Then a learning team, which is going to be a smaller set of representatives from that home team, and it'll include the executive sponsor. And that learning team, they would be the ones to actively participate in all of the activities of this program. Okay. And then the expectation for the pilot unit and the team is that once you select your pilot unit, they will need to designate a day-to-day leader. Sometimes this is the clinic manager or a practice manager, primary care provider champion. But that leader will help guide and support the work of the unit. With their support, the whole team will then conduct the test and recommend changes. And time commitment will be around the project management for this series. They will also need to have internal weekly team meetings. They will need to have time to run the PTSA cycles and participate in the monthly calls with us. And that's going to be about 60 minutes long. And then they will also need to submit the monthly reports on data and results on the changes that they've tested. So the pre-work is that once your team is enrolled, we will then ask you and your team members to review the charter, which we're also going to send you all today after this meeting. And you're going to identify and create your team to participate in this collaborative, register and attend our trainings on the collaborative care management model, fee-for-service for collaborative care model. And we also put together another training. It's called Equitable Practices Engaging Patients. And then finally, complete the series of assessments that we put together on integration and readiness. So to get started, just to recap everything, review the charter that we're going to send you, identify and create your participating clinic team, select the unit that you want to work with, submit the application, complete the pre-work, and attend our pre-session orientation that we're going to schedule very soon. So that is the end of our info session. I'm going to leave this up here. If you can scan this QR code through your phone, it'll take you to the application. But in the meantime, happy to answer any questions.
Hi, good afternoon. This is Teresa with Memorial Hermann Health System. I was curious, I had an unstable internet connection and was kicked out during the presentation. Will you be sharing this? You may have said that with the participants today.
Yes.
Okay, great. Thank you.
No problem. Any other questions?
I have 2 questions, and I jumped on a little bit late, so I apologize if I could have just missed it. I guess my first question was, what is the benefit to like you all of putting this together? Like, are you not, I don't mean that in like a weird way, but like, is this something you're looking to publish? Kind of like, what are the goals for offering the collaborative? Obviously, like as participants, it is like support, right, for implementation. And then my second, like smaller question was, in terms of kind of the executive leader, like I'm thinking about my institution where, I don't know that I'm going to convince my like division chair or something like this to like have all the time to attend these. And so what is there like a definition of an executive leader or a level that someone has to be to qualify that, or just a little more insight into that?
So in terms of the leader, we are really saying your C-suites. So it can be your CEO, CFO, but it really has to start from the leadership, right? They have to be the one to endorse this work that you're planning to implement at your clinic. So that's who we really mean by leaders. But I think, Kara, you want to add something to this.
Selena, where do you work?
I work at Washington University in St. Louis. And so like I am the psychiatrist establishing collaborative care. Like, but there's no way that I would get like my division director to commit to all of, like, they're fully on board, right? But like, they're not going to be the people that like know the ins and outs, I guess.
I'm just going to give you a couple of examples. And I think it's what we have seen is that when leadership is endorsing this work, it looks differently than when they're not. And I'm not saying that it has to be a C-suite person, because I understand for your entity, we work with FQs that are smaller, and we really need someone from their C-suite to be an endorsement person. But what we have done when we've worked with larger health systems have said the same thing. And they have said, but we have the ability to move forward. But halfway through the collaborative, they struggled because they couldn't even get time outside of clinic because leadership wouldn't allow that. They couldn't write in to their budgets to add a staff person to provide the support needed. This was a different model to the support needed to hire for that staff person to be employed in clinic, because leadership really wasn't bought in. So if you feel like, and you can read the collaborative charter, that really outlines a lot of things. If you feel like your leadership is really bought in and can endorse this and allow for the things that need to happen to move this forward, then you're the right fit for this. And if you don't feel like that can happen, then that's fine.
Okay.
So it's up to y'all. But we do find that the more, there will be some activities that we would want your C-suite people to do, or as high up as you can get, to show that teams that they're endorsing it.
Sure.
That would be ideal.
Okay.
And then to your other question, why the heck are we doing this? This is what we're made to do, right? At Mental Health America, the Integrated Healthcare Initiative, we want to see transformative change. It's part of our mission. It's part of our work at the Integrated Healthcare Initiative. We will probably write a white paper or something on this, but I think someone here is from CFHA. We're kind of in the mentality of CFHA of just like, let's make integrated care accessible for all. And, we get funding from local foundations to support this work. But we want you to be involved. We want to see some change.
Awesome. Thanks.
Yeah. Other questions? Maria, did you have a question? You said I will have to ask.
Yes, hello. Well,
Okay.
I will have to ask my, I am a PRN at the hospital, so I will have to ask my clinical director if she wants to help me with this.
Yeah, I would say you would have to ask. So what kind of a system is it? Is it an FQ? Is it a clinic?
It's a hospital.
Oh yeah, I would say higher than your director. But read the collaborative charter, and see if what we would be asking would be something that would be beneficial for y'all, right? Like, we just want to be clear, this is the heavy lift and a lot of work, and we know, because we've seen it in our sector and other sectors, that this can provide transformational change, but only if the organization is really on board with adopting transformational change.
I understand.
Hi, Cassandra.
Hi, can you hear? Oh, sorry.
I couldn't hear you.
Sorry, I forget that. So, I have a question. If I do bring this to leadership, and they are in support but have questions, or who would I direct those questions to? Is there someone specifically I should email out of you for?
Go ahead. Sujina and myself, I would say, are the two, and we would be happy to meet with people.
All right, thank you.
Mm-hmm.
I think that is all of the questions. Well, thank you all so much for joining. If you have any questions, feel free to follow up with us via email. Victoria is going to send you an email with the charter and the link to the application. So you can also reach out to her if you want to connect with me and Kara to further discuss this opportunity. But if there aren't any questions, thank you so much for joining. Have a good rest of your day.
Thank you. You all too.
Bye.
Bye.